Hi, my name is Tiffany Savory. I'm here today in regarding to more rights to healthcare. Here's an overview that I will be presenting to you today. And what does more rights mean? The elements that make up more rights to healthcare. The first one is Code of Ethics, the Stark and Anti-Kickback Laws, Health Insurance Portability and Accountability Act. Now, what does more right mean? A moral right in healthcare is an obligation to ensure that healthcare is accessible and affordable. According to the article by Marithapi Gunarjessingam, stated that there are a few people today that would argue that healthcare is all for all is a moral right, such as Peter Singer, who had adopted the utilitarian standpoint, claiming the greatest good for the greatest number, who had argued that suffering from a lack of medical care is harmful. If we have the power to prevent something harmful from happening, it would be wrong not to do so. By not introducing healthcare as a right, we are doing something wrong. No matter the circumstances or financial status, everyone has the right to receive the highest quality of healthcare. Following the moral rights of healthcare is the Code of Ethics. According to the American Medical Association, the Code of Ethics are not laws or rules but guidelines that are used to identify the essentials of ethical behaviors for physicians. They also state that ethical refers to involving moral principles, values, and practices, as well as matters of social policy involving issues of moral of the practice of medicine. There are 4 principles of ethics. Anatomy, meaning the patient has a capacity to act intentionally with the understanding and without controlling influences, which also means they have the right to either accept or reject any medical treatment. Non-maleficence, meaning to do no harm or cause any injury to patients. And another principle of ethics is beneficence, meaning providers have a duty to be of a benefit to the patient and to take positive steps to prevent and to remove any harm from the patient. And the next one is justice is a form of fairness, just like Aristotle has said, giving to each that which is his due. Everyone has the right to be treated equally and with fairness in healthcare. And this was an article by McCormick. The next one is the Health Insurance Portability and Accountability Act, also known as HIPAA. According to our textbook by Bastillos, the right to privacy means to have the right to be left alone, in which access to intimate details and information is controlled by the person. In legal terms, it's the right to limit the interference of others when making personal and anonymous choices. Now, how does the rights to privacy pertain to HIPAA? Well, HIPAA protects the patient's health information from being shared within the organization. It requires the patient's consent in order to share their protected health information. According to the U.S. Department of Health and Human Services, the privacy rule standards address the use and disclosure of individuals' protected health information by organizations under covered entities, as well as standards for individuals' privacy rights to understand and control how their health information is being used. And one way to be compliant with HIPAA is to have the informed consent. The informed consent is the idea or notion that healthcare decisions that should be made in a collaborative manner between the patient and the physician or the healthcare team, which is also an ethical doctrine and set of legal rules that prescribes certain behaviors and procedures for healthcare professionals, according to Bacelos. What this means is that the healthcare professionals cannot move forward with any medical treatment or share the patient's protected health information without their consent. And the last element I'll be going over is the Stark Law and the anti-kickback laws. According to the article by Wood, it stated that the Stark Law prohibits physicians from making a referral for certain designated health services for which payment may be made under the Medicare or Medicaid program if the physician has a financial relationship with an entity that provides designated health services. He also states that the anti-kickback law prohibits knowing and willful solicitation, offer, payment, or receipt of any remuneration, whether direct or indirect, in cash or in kind, to induce or in return for referrals for items or service covered by Medicare, Medicaid, or any other government health programs. In conclusion, the moral right to health care is important because it ensures that the patients are receiving the highest quality of health care. Also, that the hospital are following the regulations and ensure that patients' safety and rights. By having an understanding of what the code of ethics, the Stark and anti-kickback laws, and HIPAA, it will be able to ensure the quality of health care is efficient and effective to the patients. Thank you. And these past 5 weeks have been a learning curve and definitely a challenge for me. I wish everyone the best of luck in their future endeavors.